On this episode, we'll talk about using binders after surgery. We'll also talk about counting calories or counting carbs. And we'll also talk about diabetes and the sleeve. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 125 of your show, the AskDrA show. Thank you so much for being here with us. Before I begin and we start off with these really good questions, I want to give you some extra value, all right? I want to tell you that if you're not enrolled to our newsletter that we send out every week with the summary of all we do every week, including the AskDrA show, including our blog, including all our before and afters, all our stuff that we're doing behind the scenes and everything with our company, you are missing out. All you have to do is go to Endobariatric.com, scroll to the bottom of the page, you'll find the way to subscribe to our newsletter. That's number one, message number one. Message number two is, if you haven't seen that, if you are a fan of Instagram and you are not following my personal, I never give out my personal Instagram, but now I've been using it myself. I'm the one behind the scenes. I'm the one using all this stuff, and I'm going to give it out to you. I normally do not give because I use it for personal stuff, but now I'm using it. So if you want to follow me on Instagram, on my personal profile, we're going to place it here on on the screen. GMO Alvarez, which is the same username I am using for my Snapchat. Again, two ways to send me your questions using the hashtag AskDrA or through my Snapchat account. Let's go into the show.
Is it necessary to use an abdominal binder after surgery?
Okay, so should you use a binder? The answer is you don't have to. You don't have to use a binder. Let's change the question a bit. Can you use a binder? The answer is yes, you can. But let me give you a little extra info right there. Binders make you feel secure. Binders make you move a little bit better right after surgery, the following weeks, maybe 6 to 8 weeks after surgery. But it's not necessary. It will not help your skin get a better aspect down the road. It will not help you avoid any complications because of the sleeve or the skin or anything like that. On the contrary, I don't like using binders personally on my patients because they may keep the skin warm, and in summer I don't like the humidity on the incisions. In the skin, I like them dry, and that's the best thing for healing. So I don't recommend them. But wintertime, autumn, spring, you can use them. Not my favorite, but you can. Nothing happens if you feel secure, if you like to use them. Maybe you've used them before on any other type of surgery, abdominal surgery, like a hysterectomy or a C-section, and you like it. And yes, I've had an open appendectomy. I used a binder, and believe me, because I was in med school, I had to get up and go in really quick, and it helps tremendously. But that was an open surgery. This is totally laparoscopic, very tiny incisions. There's no need for a binder to avoid a hernia or anything like that, okay?
I'm in a low-carb diet. Should I also count my calories or just focus on my carbohydrate intake?
Okay, so you are doing a low-carb diet, and the question is, should I count the carbs, but should I also count the calories? To the basics, you don't need to count the calories if you're only counting the carbs. So if you are focusing on a low-carb diet, you focus on counting the carbs. If you are focusing on a low-calorie diet, you focus on counting the calories, all right? So now, this is why the low-carb diet works really good with the sleeve, because as a sleeve patient, you are counting the carbs, keeping them really low, but the sleeve is helping you keep the calories low. So the sleeve is doing the counting of the calories, but you are doing the counting of the carbs, and the results are really good.
Can Gastric Sleeve help me remove my diabetes?
Okay, so Does the sleeve make diabetes go away? Us doctors don't mention going away or curing. We mention going under remission, because once a diabetic patient is diagnosed as diabetic, he or she is diabetic. Now, you get a surgery, you lose a lot of, well, you can lose 40, 50, 60, 100 pounds, 150 pounds, 200 pounds with a surgery. And your diabetes gets so much better that even if you get some blood drawn, all your levels are really good and under the radar. That is what we call going under remission. You probably don't need the medications anymore, but it's good to keep an eye on it always, okay? If you do not focus, if you have weight regain down the road, can the diabetes appear? Yes, it can, all right? So that's why we call it going under remission. So I don't like to say it cures it, but definitely helps it and makes it go into remission. All right, so that is it for episode 125 of the Ask Dr. A show. Hey, I need your questions. So send me a question, hashtag AskDrA. All right, that way we can add it here to the show. And the question for you is, are you following me on Instagram? GMO Alvarez. I'll see you right there.